A new study looking at the way heart failure is linked to obesity found something very interesting. Body mass index, or BMI, may not be the best indicator of how much risk someone has. 9 News medical expert Dr. Kohli is joining us now to talk about it. Thanks for coming in.
Good morning.
Good to see you.
Yes, you too.
So, BMI, is it TMI?
Oh, that's a good one.
I had to drop
You've been
it. It was working in the brain. But what is it about body mass index that's not helpful?
Yeah, so body mass index has been around for decades as a metric. And the way that we calculate it, and I want you guys to know yours because this is really important, is your weight in kilograms. So that's your weight in pounds divided by 2.2, divided by your height in meters
I don't
squared.
do math.
So the easiest thing to do is put in the internet. There's all these calculators, or put it into ChatGPT, your height and your weight. It'll spit out a number. Okay, if you're less than 18.5, it's underweight. 18.5 to 25 is good. 25 to 30 is overweight. 30 and above is obesity. So it correlates really well on a population level and a little bit on an individual level. But the problem is it just tells you how much weight you have, not whether it's fat or muscle and how you're carrying it. So a Broncos football player may have the same BMI as somebody who's actually got a lot of adverse, weight and risk, and that's why it doesn't help us that much.
I have long hated BMI. If you've ever met my husband, he is lean, right? Like he's just got so much muscle, but the BMI comes back that he's unhealthy.
Yes, exactly.
And it's like a fight all the time.
Totally. So better
totally
metrics.
The case with me too. Like definitely.
Better metrics, guys. I want you to also know these metrics. Waist circumference, okay? That tells us if we're carrying weight on our tummy. For women, the number should be less than 35 inches. For men, less than 40. And then waist height ratio, okay? So if you're 70 inches tall, which is 5'10", your waist circumference should be less than half that, which is 35 inches. So those are both really good predictors. And then more fancy tests that you need imaging to figure out whether you're carrying fat on your organs. You usually need an MRI or ultrasound or something to see if you have liver fat or fat around your heart, and whether you have deep fat. Those scales you see at the gym where they tell you how much body fat you have.
Like the InBody or something like that?
That's right, yeah. Yeah, they don't work very well, but if you hit a good one called a DEXA, it tells you whether you have more muscle or more fat.
Oh, okay.
Yeah.
That's good to know. It just seems like this has been around for a while now. Why the sudden shift?
Because of the obesity medications. So I think we finally figured out that we have obesity defined all wrong, that we're using a blunt object. We're using what should be a screening tool like BMI, not what should be used to classify disease. So I think the obesity medicines have ushered in an era of rethinking. In fact, there's a new commission that's come out to define obesity, where we now stage it like we stage cancer. Because we really want to make the analogy that it's a chronic disease, that it's got long-term risk, and that just because you lose weight doesn't necessarily mean it's gone. You're just in remission, so to speak, and it could come back. So I think that that's really what's ushered it in. We've also had studies like this one that just came out that look at predictors. And like you said, Corey, in this particular study, 2,000 patients, a better predictor than BMI was waist circumference and waist hip ratio. And that also predicted how much inflammation you have as well.
Not all fat is created equal. I remember thinking, because I think babies have that brown fat or something like that, right? And that's the good stuff.
It's the good stuff, and we lose it as adults. So there's brown fat, then there's beige fat, which is actually a combination of white and brown fat. So as you said, brown fat actually is metabolically active. It protects against diabetes and heart disease. Beige fat is fat that can switch. So it can become active under certain hormonal conditions or certain temperature conditions. So cold, for example, can stimulate that beige fat to turn on, but it's not really the subcutaneous fat, the fat that we see that matters. It's the deeper fat. So the fat deep inside our body predicts cardiometabolic risk, because that's the one that releases those inflammatory markers and creates organ dysfunction, and then the fat around the organ. So we have to figure out not just how to define fat in medicine, but how to figure out what type of fat you're carrying. Is it brown? Is it beige? Is it white? Is it subcutaneous? Is it deep or is it superficial?
I got to tell you, I saw a bunch of my numbers go down when I lost some weight, and you're starting to see the impact on like your blood work and your labs.
Isn't it amazing?
It feels great.
It's amazing. Yeah, and it's the new frontier because half of Americans are going to be obese by 2030. So I really want us to start calculating these numbers and keeping an eye on how they're doing so we can be healthier.
Well, it's about time they change the BMI metric.
Yeah.
That's what I have to say.
Tell Josh to calculate the waist height ratio.
I will, yes.
For lean people like us. Yeah. It's been unfair for a real long time.
Good. Dr. Kohli, thank you.